And moving to Egypt now, the country's leading cigarette maker, the Eastern Tobacco Company, says it's raising prices by 10 to 15%. And this, of course, is only days after the country launched the first phase of its new national health insurance system, which will be covered through the new hike. Now, company chairman Mohammed Haroun said that 50% of the new price increases will be directed into the health insurance system, with the remaining 50% coming from taxes. It remains unclear whether the new increase will also apply to cigarettes produced by foreign-owned companies such as BAT Egypt and Philip Morris International. Now, both use Eastern Company factories to manufacture their locally sold products. Well, let's get an update on this from Yasser Hakim. He joins us in Cairo. Yasser, as always, welcome to the show. Now, this new hike certainly seems to be different from another tax on cigarettes, which is expected to be implemented in the next few months. So, Yasser, explain to us the significance of this particular tax and the difference between the two.
Yes, Uche, this is not really a tax. It's what you can say a fee or so forth, or a stamp that is taken to be paid for the health insurance project, which is the new comprehensive health insurance system that is beginning to be applied this year. Now, the government needs the funding for it, and therefore has decided 6 months ago. It's not a new decision, but the implementation is now. But 6 months ago, the Parliament has ratified a decision to fund the health insurance program, the comprehensive health insurance program, from the cigarettes. So smokers will be paying for the non-smokers, or people who need to be dealt with because of the issues of health in Egypt at the moment. Part of it will also go into the government for the budget. So it's not all into the this fee, but also not into the health insurance, but also a quarter of it will go to the budget, state budget for the government.
Now, as we mentioned earlier, Yasser, the company called Eastern Tobacco, it has confirmed this hike. Of course, it supplies about 70% of Egypt's cigarette market. Is it clear right now whether the new increases will also apply to the 30% of cigarettes produced by foreign-owned companies in Egypt, such as BAT?
Yes, actually, the foreign companies will pay more. The local companies, they will pay 1.5 Egyptian pounds per packet. That's the fee or the increase in price. That's around 10%. The foreign will pay around 3 to 4 Egyptian pounds, depending on the price. It's also around 10 to 11%, but obviously it's more because the imported packets are more expensive because of the higher tariffs and taxes on it. So this will also happen when we see the upcoming tax. We're talking now about the fee for the health insurance scheme, but the tax that you also talked about, that will also should be implemented in the next few weeks by after ratification from the Parliament, and this one will also see an increase in taxes on the local and the imported cigarettes in Egypt.
Now, of course, revenues from this 10% price increase will go into the budget for that new healthcare insurance system. But what is this new health plan exactly about, and how much in revenue do you estimate that this hike will generate for that plan?
Yes, the health insurance scheme is something that the Egyptians were waiting for decades. It will cover more than 70% of the Egyptian population, a comprehensive healthcare system that will see also an improvement in the quality of health services provided to Egyptians, as well as the pricing and the quality of the hospitals themselves, not just the service by the doctors and equipment and so forth. So it also entails an improvement in the hospitals and health centers in Egypt. Now, this whole scheme will cost around 160 billion Egyptian pounds. We're talking around $9 to $10 billion. That's a huge amount for the government, especially as it is undergoing a rebuilding of the economy with economic reforms, austerity measures to try to improve its budget and close down its deficit. And at the same time, it's looking for other sources, such as this fee that will bring in an estimated about, we're talking $200 million per year. And I would like to say that this fee will increase 10% every year. So it's not going to be fixed every year. It will increase by 10%. So we will see an increase in revenue next year by double, by 20%. So this means that the $200 million that they will receive this year will be $400 million next year. So, and this will go to try to cover a portion of the $9 to $10 billion needed for the comprehensive healthcare system. It's already been implemented now. They're starting in Port Said, one of the cities in Egypt, small city in Egypt, to see how it will work and try to tackle any challenges or problems that face the healthcare, the comprehensive healthcare system. And then it will gradually be implemented in other cities to reach full Egypt, the whole country, by 2022 or 23 by the maximum.
Well, many thanks for those insights, Yasser. Of course, Yasser Hakim joining us there in Cairo.